Okay, good afternoon, everyone. ขอบ Sawadee So I'm Jessica. I'm responsible for clinical marketing at Wellell, and I will do a brief introduction of 3 advanced products of pressure relief air mattress systems, and which is designed for diverse clinical needs. So after my presentation, we will have a demonstration session, and you can be able to observe the key functions and features in action. Okay, so first, I will talk about Ultima Turn, the automated lateral rotational pressure relief solution. Why is it important? It's because according to the international guideline, it is recommended that 30-degree of lateral position can reduce the incidence of pressure injury compared to the 90-degree of lateral repositioning. So I think Kun Apple already mentioned about the 30-degree, and also the guideline recommended that the repositioning should perform every 2 to 4 hours to prevent the pressure injury. However, this is a labor-intensive workflow, and also it will cause injury and pain for the caregivers. So that's why we have the Ultima Turn. The value of it is to provide a safer and more effective repositioning solution for bedridden patient. We have the alternating and turning at the same time to perform a better pressure relief. Also, we have the side bolsters, as you can see from the picture, to provide the safetiness while patient is turning. And the second is to ensure the consistency of repositioning quality to improve pressure injury prevention and further reduce the caregiver workload. Because traditionally, the positioning needs like 2 to 3 staffs, but with the automation of turning, it can reduce the manpower down to just 1, and to minimize the complexity of the repositioning. Okay. So I'll just go through the product highlight of our Ultima Turn. First, we focus on the panel of the pump. As you can see, the first one is we have the therapy mode, the alternating, continuous low pressure, and we have seat inflation. And secondly, we have the turning direction. You can select left, right, and left, right turn. And third, we have the angle setting from 10-degree, 20-degree, and 30-degree. And also, we have the time selection for the cycle time. So it can select by 1 to 4 hours, depends on the patient's needs. Also, we have a single-sided one-time turning as well. Okay, and the fifth one is we have a skin check mode. This one is for the caregivers if they need to do skin status checking for the patient. It is a short period, do a left-right turn in each for 1 minute to check the skin for the patient. Okay. Next is the mattress. So you can see number 6 is cell ventilation connectors, that while patient is in the turning but it has some emergency needs to go back to supine, we can use this to disconnect and then the patient can come back quickly. And the 7th is the side bolster control knob. So you can see the side bolster while it's inflating, but during the patient transfer, use the side bolster knob, you can deflate it and to have a better transition workflow. And the 8th part is we have the side bolster with the lower border design. This part design is because some patients, they have a lot of tubes on their body, so the lower part can arrange their surgical drains to prevent the reflux. Okay. And also to eat the cells, we have 20 cells. The very first 3 is at the head zone, and it's non-alternating or turning. And the middle part, the torso zone part, is for turning and alternating. Also, we have some rectangular cells to have a better immersion envelopment for the patient to provide a better pressure relief. Also, at the very last 5th part is the heel relief function. Also, you can combine with our positioning pillow to improve the repositioning, also provide comfort for the patient. And we uploaded our tutorial guideline on our YouTube channel. So if you're interested, we can provide it to you. And we also have some clinical cases of optimal turn around the world in different regions, especially Europe. And thanks to Kuntuk, he's sharing some clinical cases in Thailand. So we're expecting we have more clinical cases can share with you. Yeah. The next section is the optimal turn, the prone position pressure injury solution. Okay. As Dr. Kajorn was sharing, that some ARDS-related complications need the treatment of prone position ventilation, which can have a better outcome for the patient's recovery. However, this is a labor-intensive workflow. Because the prone positioning needs 5 caregivers to complete the supine position, to prone position. So you need 5 people. And for head repositioning, you need 3 people to perform this procedure. And the head repositioning needs to do every 2 hours and lasting for 12 to 16 hours. It's a really labor-intensive work. So during this, it also caused the pain and injury for the caregivers. And also, when the patient is in a prone position, actually there's a lot of vulnerable areas is exposing to the mattress, such as the forehead, the cheek, and the nose, knees and toes. These are the parts that can be a risk of getting pressure injury. Okay. So the benefit of optimal prone is to simplify the head repositioning. Okay, it can prevent caregivers and patients to get injured. Okay, so here is, as I said, for the head repositioning, you need 3 people. Usually you need 3 people to do this, but while you have the shoulder lifting mode and also the head with deflation control, as you can see from the picture, you only need 1 caregiver to conduct this procedure. Okay, so it can ease the workflow for the caregivers. And the other benefit of it is to customize the pressure relief. Because each of our cells, it has exclusive cell deflation. While the patient is in a prone position, the vulnerable areas exposed to a mattress, if you have individual cells to relieve the pressure, it can customize for its needs. And also, because sometimes in the ICU ward unit, there's a lot of tubings on the the patient's body. So you can customize for it for the tubing organization. And the highlight of Optima Prone is that, as I said, there's a shoulder lifting mode. And I think when Dr. Kajorn was sharing the shoulder lifting mode with some pillows, specific design pillows as for ear protection and throat protection. Yeah. And in the mattress, we also have multi-zone air pressure. It has different pressure redistribution based on the pressures of the patient's weight and the different parts of the body. Also, there's an individual air cell deflation for each vulnerable parts. And our top cover, it has the microclimate top cover, and the side of the air cells, it has the laser hole that can cause the microclimate management for the patient. Okay. And as for the pump, it has an LCD screen, which offers a more intuitive design for the caregivers to see what is the status that I use right now. So in the pump, it has auto adjustment for the patient's weight. And also we have auto seat inflation mode when the patient needs the seating position to prevent the bottoming out. Also, it can control as not just prone position, but you can turn to supine position as well. And the pump also has some option for battery. If with the battery, it can last the therapy mode for 6 hours. So we also have some clinical cases in different regions. And last year, we have an article published that is in Thailand, that there's 25 patients in this clinical trial and has a really good outcome. Yeah, thanks to the hospital that published this article for us. Okay. And the third one is the Crossover Neo. This is our latest product right now. It is a powered hybrid mattress designed for smarter transitions and boosting and easing care. Okay, so why hybrid mattress is important? Because there's some bottlenecks in the clinical scenario. So in some care sectors with limited resources, implementing pressure care, such as the geriatric units, it has a low nurse-patient ratio, which means one nurse is facing 5 patients. And also sometimes in these units, usually they use standard form, and they have limited budget, but the patient inside is in need in diverse pressure care. So if the pressure injury risk is increasing, they might need to change to another kind of mattress. And so hybrid mattress can provide a cost-effective option for pressure injury care compared to the standard mattress. Okay, so if for hospitals or facilities is looking to improve the efficiency of pressure care, the mattress transition is the key challenges. As you can see from the timeline, when patient is in a steady state, usually they will use the static foam or like high-spec foam for the patient. But while the pressure injury risk is increasing, it has to transfer to alternating air mattresses. And once the patient gets better or stabilized, then it has to change it back. So during these transition state, it takes time. And sometimes some hospitals or facilities are using rental services. So they have to wait for the alternating air mattress, and this might take like 6 to 10 hours. And while waiting, it will increase the risk of getting pressure injury. And also, during the transition, is a labor-intensive workflow as well. You need like 3 to 4 staff to conduct this procedure. But if you have a hybrid mattress, then it can just like reduce this transfer period. So for one mattress, you don't need to have another mattress for changing, and this enhances the care continuity and supports the early rehab and faster recovery. Okay. And so the hybrid mattress actually can replace the high-spec foam mattresses. Why I'm saying that is because for some patient that has mobile, which has a slightly movement from their self, it can cover, the hybrid mattress can cover up to category 3. But patients, if they get a higher risk, then probably they still need the alternating air mattresses. And for a patient who is immobile, which they can move it by themselves, because they have a high pressure injury risk, probably it can only cover around like a mild risk of the pressure injury. But hybrid mattresses is ideal for like most of the patient if it's in a steady state, but it has a minimum risk of pressure injury. Okay. So, what our Crossover Neo provide the value is to support the recovery in every moment. It has 4 therapy modes, which is reactive, continuous, low pressure, and alternating and max firm. Okay, support the clinical transition and reduce caregiver's workload. So first, it's the mattress itself. While patient is in a steady state, probably it can just lie on this mattress. But if the pressure injury risk is increasing, probably it needs to boost care. So you connect with a pump, and now it's at this power active mode. So it has the continuous low pressure and alternating. And if the caregiver needs to do the nursing procedure for the patient, it has the max firm mode for it. And once the patient gets better or stabilized, it can ease the care. So it can just disconnect the pump and back to the mattress itself. Okay, so the benefit for it is to reduce the risk and the waiting time during patient transfer. Also, it can to ensure the uninterrupted nursing workflow. Okay. The design benefit of this mattress is to deliver continuous comfort, safety, and stability. Okay, so as you can see from the panel, it has the pressure level adjustment, based on patient's weight. Also, the mattress itself has 3 zones: the head zone and the cutting for the head zone, and also the torso zone has the foam in cell feature, and the heel zone that has a slope and the grooving cutting that can provide the heel protection. And on the outer frame, it has a supporting edge. It's better for the transfer for the patient. And last is the features of other features of the crossover Neo. So in addition to what I just mentioned, it also has, the pump also has the alarm indicator. If the error occurred, you will notice what should the troubleshooting should do. And also the last, I think we have you can see number 8, we have a handle on the side, so it's better for the caregivers to carry the mattress. And there's another small hanger on the side. If you disconnect the pump, actually the connector can be hanging on there, so it won't like swaying around. Okay. Oh, sorry. So in conclusion, for the crossover Neo, it's one mattress to cross over the stages of care. It provides all-in-one solution from acute to rehab and long-term care. And also it has the option to replace the high-spec foam, combining the comfort, stability, and flexibility, which provides uninterrupted care transition across the recovery. So during the demonstration session, you can like touch the products and feel it by yourself. Okay, so this is the end of my presentation, and thank you for your attention. ขอบคุณค่ะ